All right, today we are going to demystify one of the most common medical tests out there, but one that most of us don't really think about, the urinalysis. Seriously, most of us have done it, but what's it all about? You know the drill, right? The doctor hands you that little cup, points you toward the restroom, and you've probably had that fleeting thought, what on earth are they actually looking for in there? Well, today we're going to be detectives and find out.
Ah, the familiar little cup. It's such a universal experience, isn't it? But you know, it's so much more than just a routine step. It's really the first piece of evidence in a fascinating investigation into your health.
And here's how doctors see it, which I think is pretty cool. They look at that sample as a kind of liquid report card. It's a snapshot that gives them clues about your kidneys, your liver, your entire metabolic health, really. It is an incredibly powerful tool packed into one very simple test.
So, let's back up. Why did your doctor even ask for this test in the first place? Well, it usually comes down to one of two things. Either they're being proactive or they're investigating something specific.
A lot of the time, it's just part of your routine annual physical. It's a fantastic way to screen for potential problems like diabetes or kidney issues before you even feel any symptoms. And, of course, it's a standard part of confirming a pregnancy and for checkups along the way.
But then there's the other side of it. Your doctor might order the test because you came in with a specific problem. You know, things like pain when you go, feeling like you have to go all the time, or just noticing that something looks off. Those are all red flags that tell your doctor, hey, let's take a closer look.
Okay, now for the really cool part. Once your sample makes its way to the lab, what are the actual clues they're hunting for? First up is acidity, or what they call pH. See, your body works incredibly hard to keep a perfect acid-base balance. So if your urine's pH is off, either too high or too low, it can be the very first clue that maybe there's a kidney issue or even a urinary tract infection brewing. Next, they look for protein. Healthy kidneys are like these amazing superfine filters. Their job is to keep all the good stuff, like protein, inside your blood. So if a significant amount of protein is spilling out into your urine, that's a pretty clear signal that the kidney's filtration system might be having some trouble.
The glucose, or sugar clue, is another huge one. Normally, your body is really good at using or storing any sugar you consume for energy. If there's extra sugar just floating around and showing up in your urine, well, that's a classic sign that your body isn't processing it right, and it often points straight toward diabetes or prediabetes. Now think of your white blood cells as your body's personal security team. Their whole job is to find and fight infections. So if the lab finds a whole bunch of them in your urine, it's a dead giveaway that your immune system is in the middle of a battle against an infection or some inflammation somewhere in your urinary tract.
And here's another clever clue they look for to spot infections. Certain kinds of bacteria, the ones that usually cause UTIs, do something interesting. They take nitrates, which are totally normal and come from our diet, and they convert them into something called nitrites. So finding those nitrites is a really strong sign that you've got a bacterial infection.
The lab also looks for something called bilirubin. This is basically a waste product that's left over when old red blood cells get broken down. Your liver is supposed to clean this stuff up. So if it starts showing up in your urine, it can be a warning sign that the liver might not be doing its job quite right.
So the lab has gathered all these clues. What happens next? How do you and your doctor actually figure out what it all means? This part right here is super important. You absolutely have to understand this. These results are just a snapshot, a moment in time. They reflect what was going on in your body at that exact moment. Things like what you ate for lunch, what medications you're on, even just being a little dehydrated can affect the results. It is not a permanent record of your health. And because of that, one abnormal result is almost never a final diagnosis. Think of it more like a pointer. It's a big, flashing arrow that tells your doctor, hey, maybe we should look into this a little more. It's the start of a conversation, not the end of the story.
So when you pull it all together, you can really start to see why this simple test is seen as such a powerful, snapshot of your overall health. Let's just quickly recap why it's so valuable. It's just so powerful. It can find diseases before you even know you have them. It helps doctors nail down common issues like UTIs really fast, and it's absolutely crucial for monitoring ongoing conditions to make sure treatments are working. So yeah, the next time you're handed that little cup, you'll know exactly what's up. It's not just some silly routine. It's a really simple test that opens up a surprisingly powerful window into your health. It really makes you wonder, doesn't it? If that little cup can tell us so much, what other secrets is your body telling you every single day? Definitely something to think about. Thanks for tuning in.